Okay, so what if one of the most common men's health issues wasn't just, a performance problem, but was actually a signal from your body about something much deeper? Today, we're going to dive into the surprising hormonal links behind premature ejaculation and how new science is completely changing the game in our understanding of it.
So let me just start with a quick question for you. What do you think is the single most common male sexual health issue on the entire planet? Now, your first guess might not be the right one because the data points to something that is way more widespread than most people think.
Yep, it's premature ejaculation, or PE for short. And get this, 30%. That's what the research says. It affects at least 30% of men globally. I mean, think about that for a second. That's nearly 1 out of every 3 guys. So let's be super clear. This is not some rare condition. It is an extremely common issue.
Okay, so to make sure we're all on the same page here, let's just quickly nail down what we're actually talking about from a medical point of view.
If you strip away all the myths and the slang, the clinical definition is actually pretty straightforward. It's defined as ejaculation that happens sooner than desired with a real lack of control. So you see, it's less about a stopwatch and way more about the personal experience itself.
And this right here, this is probably the most important part of the whole diagnosis. The key factor isn't just the timing, it's the emotional impact. When it starts causing significant distress or frustration for either person, that's when it crosses over into being a clinical issue.
For the longest time, for decades, the conversation around PE was pretty much all about psychology. Things like performance anxiety or stress in a relationship. But in just the last few years, a much bigger, more complex picture has really started to take shape.
And this is a huge shift in thinking. Look, no one is saying that psychological factors don't matter. They absolutely do. But what we're seeing now is that PE can have clear biological, even genetic roots. It's not just in your head. It can be literally rooted in your body's basic chemistry.
So that leads us to the big question, right? If biology is a key player here, then what exactly is happening on a hormonal level? Which systems in our body are actually involved in controlling something this complex?
Now, the first hormone that probably pops into your head is testosterone. But surprisingly, the evidence here is, it's a mess. Some studies find a link to low testosterone. Others find a link to high testosterone. And a whole bunch of them find no connection at all. So what does that tell us? It tells us that testosterone, while obviously crucial for sexual health, probably isn't the main driver of PE. The real story is a lot more nuanced.
So if testosterone isn't the clear culprit, where have researchers found strong, consistent connections? Well, the evidence points right at our metabolic and endocrine systems.
Let's start with blood sugar. The link here is pretty striking. In some studies, the rate of PE in men with type 2 diabetes was over 60%, and the research showed that the worse someone's blood sugar control was, the bigger the risk. And it's not just full-blown diabetes. Even in men with prediabetes, the rate was around 35%, which suggests this connection starts showing up really early.
And this pattern continues with something called metabolic syndrome, which is basically a cluster of conditions like high blood pressure and central obesity. One study found that men with this syndrome had a 2.2 times higher risk of developing PE. In fact, the risk just kept climbing with each additional factor they had.
So these metabolic links are a really big deal, but the research points to an even stronger, even more direct hormonal driver. In fact, the most compelling evidence we have comes from a tiny, little butterfly-shaped gland right in your neck.
And here we are, the thyroid. In one landmark study, a staggering 50% of men with an overactive thyroid, that's hyperthyroidism, also had PE. 50%. Now compare that to just 15% in the general population. That is a massive difference, a very clear signal.
But this is the most compelling part of all. When those same men were treated for their overactive thyroid, their rate of PE dropped from 50% all the way down to 15%, basically right back to the average. This shows a direct cause and effect. You correct the underlying hormonal imbalance, and the symptom of PE can actually resolve along with it.
The investigation doesn't just stop with the thyroid either. Researchers are exploring all kinds of other hormonal players. For instance, some studies have found links between PE and the pituitary hormone prolactin. Others have found significantly lower levels of vitamin D, which also acts like a hormone in the body, in men with lifetime PE.
Okay, so we've looked at the metabolic system, the thyroid, the pituitary. What does all of this actually mean when you put it all together? What is the big picture here?
Well, it all leads to this powerful new way of thinking about it.
Instead of just seeing PE as an isolated performance issue, this research suggests it can actually be a symptom, kind of like a check engine light for an underlying metabolic or hormonal condition.
So let's just recap the key things to take away from this. First, PE is incredibly common. Second, it is not just a psychological issue, it can have clear biological roots. Third, several of your body's hormone systems are involved, especially with things like diabetes and hyperthyroidism. And finally, and this is the most important part, treating that underlying hormonal condition can often directly improve the PE itself.
And this leaves us with a really powerful final thought. Could a health issue that shows up in the bedroom actually be a signal for your overall health? It seems that by paying closer attention to our sexual health, we might just get critical insights into our systemic health, because sometimes what happens in the bedroom doesn't stay there. It can be a really valuable signal from the rest of the body. Thanks for watching.